Hello, everyone. Good evening. Thank you so much for coming today. I hope everyone's having a lovely climate prep week. My name is Samantha Palladini, and I am the Climate Resilience Hub Program Coordinator with CREW. If you don't know us, CREW stands for Communities Responding to Extreme Weather. We are a nonprofit based in Cambridge, Massachusetts, under the Better Future Project, working to build climate resilience in grassroots communities through education, service, and planning. So each year we help host Climate Prep Week, a series of educational events throughout the last week of September, along with many other organizations to promote community engagement. We believe social connectedness is an important element when it comes to building resilience towards future extreme weather events. And we have a number of amazing events being held during this Climate Prep Week, bringing awareness to climate change, environmental justice, bringing tools to your community to help each other prepare for emergency events. This year's theme, the intersection of climate change and the broader social justice movement, is meant to make us think about how our changing climate is affecting different aspects of the human experience. The rising level of heat waves impacts our communities, especially those who don't have the resources to cool themselves down, people who are homeless, BIPOC communities affected by redlining, frontline workers. Everyone has a right to experience relief from weather that can potentially increase the risk of heat-related illnesses such as heat exhaustion or heat stroke. So today, CREW is here to present a wonderful panel of speakers from numerous universities in the Boston area to speak about their expertise and experience building climate resilience with a focus on heat in relation to health and racial justice. Now I'm going to pass it off to our wonderful moderator for today's event, Leah Bamberger, who will first introduce herself and our speakers, one of which you will get to meet later on in this panel. Then Leah will ask our panelists questions, and if you yourself have any questions or comments, please feel free to contribute to the conversation by typing in the chat. Well, without further ado, take it away, Leah.
Thank you, Samantha. Hi, everyone. Good evening. My name is Leah Bamberger. I am the Executive Director of Northeastern University's Climate Justice and Sustainability Hub. The Hub has been, we're fairly new. We've been around for about a year and a half, and we are charged with helping Northeastern align its climate and sustainability agenda with sort of the broader community, in particular, those communities that are most impacted by the climate crisis. So really excited to be here today and talking about extreme heat and some of the strategies that we at Northeastern are taking to help support not only our campus community, but the surrounding neighborhoods as well. But before we get to that, I am going to ask Caleb here to introduce himself and talk a little bit about the impacts that you're seeing at sort of the individual level from a public health perspective. Caleb.
Hi, everybody. Nice to meet you. My name's Caleb Dresser. I'm an emergency physician practicing in Boston, and I'm also Director of Healthcare Solutions at the Harvard Center for Climate Health and the Global Environment. So my concern about this issue is twofold. I'm a doctor, I'm treating patients, and I'm seeing impacts from heat. And some of those impacts are pretty significant: heat stroke, heat exhaustion, and a variety of other medical issues. The other half is that as I look at this bigger picture and think beyond the doors of my emergency department, there is a lot we need to be thinking about together as a community, as a society, about what we do to keep one another safe during hot weather. I want to share a couple of cases and perspectives, and I have eliminated all of the personal details from this, but I think that the meaning remains very clear. The first is an elder that I took care of who lives in a community near Boston and lived on the top floor of a building, and her air conditioner broke. It was summer, it was hot, and she ordered a new air conditioner. It was actually delivered to her apartment, but she didn't have the upper body strength to install it in her own window herself. Air conditioners are heavy. And she didn't have someone she felt comfortable asking in her immediate area that could help her. And so as the heat wave that was going on at that time continued, she wound up sitting in front of a fan, which can help you feel cooler, but it evaporates all that sweat off your body, and she became quite dehydrated. She was found 3 days later, confused, and was brought to our hospital and wound up admitted, hospitalized, and did fine. But that was a very close call for her. And I think it highlights the degree to which this is a health issue, but it's also a social issue. It's a housing issue. It's an access to cool spaces issue. And that what we can be doing is not just provide medical care, which of course we do when people need it, but also make sure we're checking on people around us, make sure we're thinking about how to prevent people from getting into dangerous situations, or how to maybe take them in for a couple of days where we have air conditioning if they do not. So I have a lot more thoughts on the big picture public health questions, and we'll be sharing some of the work we're doing at the Harvard School of Public Health to try and equip clinicians, nurses, doctors, et cetera, with tools to help counsel patients about this issue. But I'll pause there for now, and we can hear from some others on the panel as well.
Oh, sorry, I was muted. Thank you, Caleb. Really important story. And one thing that came up for me in hearing that is also, it sounds like it's an issue of social isolation as well. So I'd love to dig into that a little bit later. All right, well, so we do have a third panelist joining, Professor Ted Landsmark, also from Northeastern, but he is at a BPDA hearing at the moment. So just a heads up, he'll be joining later. But Torrey, I'd love to turn it over to you and hear kind of zooming out a bit to the institution scale. You've been working on heat resilience at Northeastern. Can you talk a little bit about the ways in which you've engaged with the broader community and sort of the why and the what of what Northeastern is doing?
Sure, thank you. Yeah, I mean, at Northeastern, as Leah mentioned, we're really committed to making sure that the work we do in the sustainability space aligned with community priorities. We're going through quite a process to really better understand that. In the meantime, we wanted to be able to be responsive to the summer, this last summer, and responsive to the pressure that heat has on our communities. It's sort of, many of us know, it's very dangerous. It's actually, excessive heat is the leading source of death in the US. The burdens are inequitable, which has a little bit to do with geography, but a lot to do with kind of the resources that people have during heat. And as climate is changing, particularly in this area, I think there's an increase from, by mid-century, we'll have like 25 to 42 days above 90 degrees during the summer. So that's a lot. That's a big bulk of the summer. So that's why we thought it was an important issue to begin really grappling with. So in the fall, just a little story here, Mayor Wu had reached out to the private sector to say, how can institutions and others step up to support our neighborhoods in Boston during extreme heat? And originally, you know, the city spoke of their cooling network, which is a great resource. And we thought, okay, how can we help? How can we expand that cooling network? So we talked to many people, many neighbors and our sort of community leaders in our neighboring communities, to the city, to folks who've been running those networks. We talked internally to say, okay, how could we make our space, our campus, serve during these events? And we had this vision of how we might do that, how we might expand this network of cooling centers. But based on these conversations, we realized we were a bit off the mark. That we realized that this would not be the most effective way actually for us to engage and support our communities at this time. So we began the discussion of what would be a good start? How do we begin to be most impactful? And first I'll say there are a few reasons that didn't really resonate. One was that cooling center capacity, it turns out, is not a limiting factor. There was a lot of space there. There was some nearby, but it was more an issue of how do we get people to those spaces? And that's sort of both physically and how do we encourage people to get there? But we also, you know, realized that if our campus is supposed to support our neighbors during stressful times, we need to actually build stronger relationships with our neighbors and help them feel welcome on the campus. But we also learned through these conversations that people are seeking information. So we got this new focus really on building relationships, particularly with older adults and kids who are at high risk, at meeting people where they are, where they're comfortable. We learned that people like water, so we found ways to integrate that. And we thought about how we could contribute as a campus, as an institution in the city, to the longer term urban environment and cooling the environment. So I'll show you kind of a few things we did, and then let us get to the rest of the conversation. So we thought of this really as sort of a series of pilot efforts. One of them was, again, really about connecting community with our cool treats in the community. And these were some of the people we'd spoken to about our ideas, and they said, you know, our community would love to connect more with you, to know that they're welcome at Northeastern, that they're part of our larger community, to learn. I actually do want to learn about what we can do during the heat, and just to have fun as part of it. Summer is actually a fun time for people. So we had these cool treats in the community. We had Dell's soft frozen lemonade, which was a huge hit for all ages. We met up with 8 summer camps, the Tobin, the DeWitt, in Mission Hill, a variety of places across the street from our campus, at Whittier, and this up in the upper. So here you see some of the seniors. They really said, but what would you want to do? And we learned to play bingo. But they had a blast playing bingo. The kids playing other games, and then you know, for communications, the city has some great resources about what to do, and they have it in 15 languages or maybe 10 languages. So we were able to share that, and also heard, okay, but the kids aren't reading that. How can we help the kids that we're meeting think about how to keep themselves safe and cool? And so we had some fun creating some graphics to share at those events. We also did these, what we called cool spot pop-ups. We know people like to be cool, like water, but we weren't going to try to bring people out of their homes or out of places necessarily during these heat events. So what can we do if people are going about their day to help them cool off? Our campus is in the middle of an urban center. It's right near Ruggles Station. Let's provide water. Let's provide water stations. Let's provide misters where people can walk through, you know, near Ruggles Station and just kind of enjoy a little cool off. So that was like a small pilot. We're seeing about expanding potentially next year. And then again, we are very much in the middle of this dense urban environment of different neighborhoods, and we share our streets and our edges with our community. So how can our urban forest as Northeastern, as we think about how we develop our landscape, as we plan for our urban design, how do we really think about the tree canopy in particular, particularly street trees, and ways that can help people feel more comfortable as they're moving through the streets in their daily lives. So just a few examples of ways we're beginning to kind of explore, but eager to learn more from the other panelists in this discussion.
Great, thank you, Torrey. Really interesting point about the cooling shelters, the cooling centers, and how those seem to be underutilized. And Caleb, I'm curious if I'm just thinking about the story you shared with the elder. What do you think prevented that person from visiting a cooling shelter rather than seeking out the fan solution? And would that have been helpful?
Yeah, great question. I mean, I think when we look at heat, it's affecting everybody, but it's also affecting everybody differently. And the solutions have to fit a whole lot of different needs for different people. So I don't think there's going to be a one-size-fits-all solution to this. And what we need is a combination of social approaches, architectural approaches, economic or policy approaches, and technological approaches, things like air conditioning in some places. And so when you think about it, I like to think about who is this, right? I treat patients one at a time. And for some people, going to a cooling center is scary. It's a government place. They may not be documented. They may not want to go to that place. Getting there involves transportation. They may not be able to afford transportation, or they may have physical mobility issues that prevent them from getting there. If you look at something like an air conditioning unit, hugely protective, but it costs money, right? You have to be able to afford the electricity to run your AC unit. So every solution we come up with for heat has advantages and disadvantages. And I think what we need to be doing is making as many different solutions as possible available to as many different people as possible and try to meet them where they are. And I think when it comes to who's at risk, there's a lot of good epidemiology research that's been done looking at big data sets, looking at tens of thousands, hundreds of thousands, in some cases, millions of patient visits to understand who's dying, who's getting admitted to the hospital, who's going to the ER. And some groups are at higher risk. Older adults are at higher risk. Young children are at higher risk. If you're pregnant, you're at higher risk. Outdoor workers, people living with physical or other disabilities, people on certain medications, the list goes on. And there are also certain neighborhoods and communities that are at higher risk. Places that were historically redlined are at higher risk. And I think Professor Landsmark is going to be here to talk more about the race component to this, but it's an important piece of this conversation that we all need to be thinking about how we can address. So when you think about all of these different groups that are at risk in different ways, the solutions are also different. For an older adult who lives alone, what they may need is social connectivity. There was a devastating heat wave in Chicago in the 1990s where hundreds of people died. And an in-depth sociological analysis that was done after that event found that one of the most protective factors was your social network. People who were well connected to other people survived because they got checked on, because they knew somebody down the hall didn't have air conditioning. They checked on them and they invited them to come over and sit in their air-conditioned apartment, and that saved their life. These feel like small steps to a lot of people, but they can be really big in somebody's life. For other populations, the answers may be different. If we look at our unhoused population, well, that's not necessarily a social connectivity issue. That's an access to cool spaces issue. And in some cases, an access to cool spaces where they feel safe and welcomed and that are physically proximal to where they're located. So these solutions are not going to be one size fits all, but this big picture approach that Torrey alluded to, where you're thinking about lots of different ways that an institution or ways that a community or ways that each of us as individuals can take action. I think what you're going to find is that for the people you're working with, there is some best first step, and that taking that best first step is the first move, and we should do that and then keep learning from there.
Absolutely. And then just a follow-up question. Torrey mentioned this sort of information gap, perhaps, or one of the things that people were interested in once we started engaging with them was just a need and interest in information. Are you seeing that come up? Do you think a lack of information is about the risks and the solutions as part of the challenge?
I certainly do. I think there's a lot that isn't obvious about heat. When there's a tornado, when there's a hurricane, it makes the news, right? And this summer, we started to see heat making the news as well. But I think there are a lot of people who do not totally realize how dangerous this is, or how dangerous this might be to people around them, even if they themselves are okay. So one of the projects we've been running at the School of Public Health has been developing educational resources focused on the needs of high-risk individuals in what we call frontline clinics. So free clinics, charitable clinics, federally qualified health centers that are serving people who are outdoor workers, people who may not be able to afford air conditioning, and trying to provide evidence-based guidance that is aimed at reducing their risk of becoming sick. Because I, as an ER doctor, am here to treat you if heat stroke happens, but it's way better if we prevent that. And that's what the focus of these informational resources has been. So what you see on the slide here is a screenshot of a website, which I think we can share in the chat, that is a heat health toolkit developed for those clinics. And on the right-hand side of the slide are just a couple of shots of information that might be handed out as part of a general tip sheet to a patient or a concerned person, with information about where to get reliable weather information, staying hydrated, how to tell if you're hydrated. Yes, what your pee looks like matters. And that's part of paying attention to your body in really hot weather and making sure that you're taking good care of yourself. And a variety of techniques that people can use that are cheap, that don't involve paying for air conditioning in all cases, but might help them get through moderately hot weather. And then finally, information about when to seek emergency medical care or when to call 911 on behalf of somebody that you've encountered outside. So I think information is a very important piece of this conversation. It's not the only part. People need air conditioning. People need cool spaces. People need cool, safe spaces where they feel welcomed. But I think recognizing the problem, understanding who's at risk, and having some practical steps you can take is a really good start at addressing this.
Yeah,
If I can-
oh, go ahead, Torrey. I was just going to say real quick, and people need to be able to get to the cool spaces, right? The transportation piece is just makes me think about the sort of layers of the systemic challenges and barriers that are resulting in these outcomes. But go ahead, Torrey.
No, that's a wonderful point. Just back, Caleb, on your point of the communication toolkit, that looks like a really great resource. One thing we learned as we were talking with our internal staff, we've got a lot of frontline workers that work at Northeastern in our organization, and so we had conversations with them, and mostly with managers. And one thing we heard is it matters who that messenger is, who they get the information from. Some of that is trust, as we all know, but some of that is just being able to hear from the right person, manager, that they have the right to be concerned, if you will, the right to take a break if they need it, to express that they're challenged by the weather is another sort of important component.
Absolutely. I actually took care of somebody a few years ago who arrived in my emergency department unresponsive, and we put in a breathing tube a couple of minutes later. They had a core body temperature over 108 Fahrenheit, who was an outdoor worker who had been on a work site during very hot conditions that turned out to be very nearly deadly. And they survived, but that is a totally preventable episode that goes back to partly awareness and education of everyone in a workplace, but also to making sure that workplaces are required to be safe and that people feel comfortable demanding that they be safe. Because we're going to see more hot weather in the years to come. New England region is warming. The heat wave season is getting longer. Heat waves are getting more intense. They're getting hotter. And we have to adapt to these impacts. We have to keep one another safe. And that workplace piece is really important. I'd love to hear a little bit about how you've been approaching those conversations to sort of make sure that people are comfortable asking for what they need.
Yeah, I mean, this is evolving, and we're not necessarily in the lead on it, but we have been working with our colleagues who are really, I think, ramping up their focus more generally on safety communication, particularly around extreme weather, although many things. But part of it is really being able to kind of have that check-in in the morning, have their supervisor say, you know what, I know it's really hot today. Whether you're an outdoor worker, you're working in a small, air-conditioned mechanical room, make sure you drink water. Here's some things you have. Let us know if you're struggling. And it's often just that sort of verbal check-in in that morning that we hear goes a long way.
And one thing I will add, and Caleb, I'm curious if you have, if this has come up in your work at all, but there, especially some of our outdoor workers, laborers, there are union issues, right? And taking like a break means a certain thing and legal terms. And I'm curious if you have any insight into whether or not labor unions are engaged in these conversations.
So I am not a labor expert. I'm a doctor. I would say my general understanding is that increasingly people are concerned as they become educated about these risks and as they live with them, right? It doesn't take me telling you it's dangerous that it's hot out to realize that if you're working in 100-degree plus weather outside or inside, because a lot of workplaces are not air conditioned, particularly for people who are doing, construction work or indoor industrial work. Those environments can get extremely hot and be quite dangerous. So I think there is concern and interest. I can't speak to the details of what that's looking like in labor negotiations.
Right. Yeah, it was an interesting point that came up that we hadn't thought about or heard from that angle. I'd also encourage folks who are here in the chat, maybe share where you're joining us from, and particularly if you have had any experiences, like how are you perceiving or experiencing these extreme heat events, and what are you noticing in your community, or what are some of the challenges? We'd love to bring your voices into this conversation as well. So Torrey, jumping back to you here, what do you see as some of the next steps for this work with Northeastern? Where would you like to see this? How would you like to see this effort expand?
Yeah, well, now we sort of rushed and had our pilots this summer, and they were fun, and there was a lot to learn, and so we're in the process of really reaching out to the folks that helped us put this together, to the folks that we talked to get ideas from in the community, and figuring out what worked. What could we scale up? What maybe didn't work as well? What might we have to change? So I don't know exactly where this will head, but I think we had enough success and support in this first year that that will sort of grow our, give more support for our efforts in the coming years. And Caleb, back to your point, there is no silver bullet here, whether that be, that there are different populations, there are different needs. There's so I think it'll be a multi-pronged strategy that'll involve both sort of our campus and how it contributes to the urban environment in the sort of medium to longer term, like through our urban canopy, and how we can really support folks during just extreme heat events, helping them survive and hopefully thrive during the day.
Yeah, I think somebody, Jesselyn, has brought up a really good point in the chat, which is the sort of mental health component of this is not small. And that, there's, from a scientific standpoint, there are studies linking hot weather with thinking more slowly and having a harder time on standardized tests. There are also studies linking hotter weather with interpersonal violence and irritability. And so, part of that is, as a starting point, simply being aware that that is an issue and having a little bit of insight that, like, all of us are going to be stressed when it's hot, and some awareness that, yeah, things might not be running quite how they usually do when we're thinking and feeling, which can help people sort of deal with some of that, but also recognize when maybe it's an unsafe situation or necessary to sort of get out of whatever they're in.
Yeah, and another great comment here from Robin about the importance of having physicians and other medical professionals speaking about these issues with their patients, and especially side effects with certain medication can make folks more susceptible to heat exposure.
Yeah, this is a really big challenge because I think for a lot of people, medication safety during hot weather is something that we are now learning about, right? And a lot of medications, when they're studied, are studied in the general population, which is mostly not experiencing a heat wave. And so there are certain classes of medications, and that link to the toolkit that I dropped in the chat has a lot more detail on this, but classes of medications like diuretics or water pills can, make you pee out some water, which is helpful in normal conditions. But if you're also sweating and hot and stressed, it might overshoot a little bit. There are other medications, some psychiatric medications can interfere with how your body adjusts to heat. And a variety of other medications can have issues as well. And so being aware of that and knowing when to be extra careful is really important, and is not something that's always obvious to patients or their doctors, because this isn't something that we as a society have been used to dealing with. And so I think this is important for doctors to speak about with their patients, as Robin mentions in the chat. I think it's also important for everyone to speak about with one another. And in the same way that dealing with climate change, step one is talking about it. I think learning to live with heat is step one, recognizing this is more than just a temperature and it's uncomfortable. This can be dangerous for some people. It can make other people irritable or have a hard time thinking clearly. And we need to recognize that and figure out what steps we can take to help one another out.
I think that gets back to that issue of culture. You mentioned how, a tornado or a hurricane, people see that as a clear threat, and or a nor'easter, right? We have sort of a protocol of what you do when a nor'easter is coming. But with heat, we don't have that routine or that muscle of how do we respond to heat as a community, what is that in our culture? And I think that is a big part of the challenge, right? I think there's this sort of sentiment that oh, it's hot, just kind of suck it up, you're fine. But conversely, in a snowstorm, it's understood that everyone's going to hunker down and stay in, and that's like an acceptable response. Whereas during heat, I mean, I think it was maybe last summer, and even some extent this summer, slightly different issue, but with the smoke and the air quality issues that we were seeing, I guess that was earlier this summer, and there were still, some outdoor events were canceled, but a lot of them were not. And the exposure to even, low levels of smoke do have significant impacts, and we're just not used to responding in those ways. So that culture piece, I don't know if you have anything, either you and anything to add to that.
Yeah, what I would add is that we should not underestimate heat in New England, in Boston, just because we're in the temperate zone and we're in the northern part of the US. When you look at the public health data for the whole country, there's something called a minimum mortality temperature. It's the best temperature for humans. And above that temperature, people die at higher rates. In the American South, in Texas, in the Deep South, in the Southwest, that temperature is 10 to 15 degrees Fahrenheit hotter than it is here. In other words, it doesn't take as much of a heat wave to start killing people in Boston as it does in Houston. And I think that is probably related to a combination of access to cool spaces and cultural adaptation to what to expect during hot weather and what to expect of other people during hot weather. And so as we think about that, we need to remember that within the Northeast, about 15% of people do not have in-home air conditioning. And that I suspect that group of people lines up with people who are living in urban areas and may have lower socioeconomic status and fewer resources to deal with heat. And so we need to really pay attention to this issue, even though we are in a northern US temperate city that hasn't historically dealt with a lot of heat. It's coming. It's already here now to some extent, and it's going to get worse. But there is a lot we can do. This is not all doom and gloom. This is a call to action, because there are specific things we can do, and we've mentioned several of them on this call, that will help keep people safe, and we need to do those.
Torrey, did you want to add anything to that? I'm thinking about, some of the events and perhaps conversations that were had this past summer. How are people responding to the information?
Yeah, I was almost surprised people were looking for more information. I thought their communities were looking for more information, but people really are. It's not. I think, to Caleb, some of the things that you spoke to, it's just not as common here to reach really hot temperatures, really dangerous hot temperatures, and it's becoming more common. So how do people deal with that? They'd love more information on it. In the resilience sort of frameworks that we see across many kinds of resilience, particularly climate change resilience, we hear about shocks and stressors. And the shocks are the tornadoes and major storms, and these stressors are almost a little bit harder to get at because it is a little bit of the frog in the boiling pot of water. It grows slowly, but it does reach a point of danger. So being able to communicate, one of the things I liked about the events is particularly the one we did with our an elderly community that lives located near Northeastern, is you could see they were building and they were connecting to Northeastern, which was great, but they were building their own community as well. This was an event that helped them all realize they have their friends there watching out for each other while they're kind of in the background learning about really the risks associated with heat. I think the more we can do there, support those efforts, that will help support the larger effort.
And Caleb, I'm curious, hearing this work, what Northeastern is doing, any reactions, or I think my question really is around, what do you think institutions like Northeastern can be doing? Like, what is our role in this work?
Yeah, I think this is all very much on the right track, right? It's understanding who's at risk. It's trying to build bridges between entities that have resources and people or communities that will need them during these events, and trying to break down some of the social barriers that can prevent people from getting what they need. And so I love what's being described. I would also love to hear from people who are on this call, perhaps hiding behind your camera being off, on what you think from where you're living with your lived experience. Because as I've spent time talking with people about impacts of climate change, including heat, I am consistently impressed by the number of different solutions that people and groups are coming up with that don't always make it into the media, don't always make it into the scientific literature, but they're definitely worth sharing and talking about and learning about. So would love to hear from anyone on this call who has perspective on their lived experience of heat, or on solutions that they've either been involved with or would like to see.
Yeah, it's a great question. There's some discussion in the chat to that effect. The mention of the lack of air conditioning among low-income communities and the unhoused, and how trees are a great solution to help cool urban areas. And there's a question here from Robin. Is there any communication with other areas of the country that have dealt with higher heat for longer, who may be able to share more systemic efforts to help with these issues?
I can take that one, but I would love to let the people with their hands up say something first.
Sure. Let's see if I can. Oh.
I think
oh, there you go.
Hi, I'm calling in from Eugene, Oregon, where, as I mentioned in the chat, we have smoke and heat in combination. I work in a CBO where we provide a cooling center. But one of the things we've been able to help people with, especially immigrant communities and people who work outdoors, Oregon Health Authority has an AC and air purification distribution program, and the requirements to be eligible for that are pretty minimal. Like, technically you're supposed to be on the state health plan, but they recognize that people may be undocumented or don't have the linguistic or tech capacity to navigate that system. And so they've made it pretty accessible for CPOs like us to simply register people directly, even if instead of a social security number, we just put a set of zeros and we just send them a note saying, we spoke to this person and they're in need. And then the state just directly FedEx's mobile units that can fit in mobile homes and other settings directly to that person's home. So that's made, these like devices that are like $200 to $600 a lot more available to people in the community. And I think they distributed 5,000 this year. And then after each season, they have feedback from groups such as ourselves about how to improve the system. One of the challenges was that the state had kind of told their admin team, like, okay, once there's a heat alert, start distributing, which didn't really make any sense. So that team and organizations like ours have been just giving feedback to the state of like, this needs to be available over the course of the year so people can sign up and get on the list to have that distributed in June instead of in August. But I will say as a recipient myself that it was extremely fast. I thought it was going to take like 12 to 15 weeks, and I put in a request and I had an AC or air purifier unit or AC unit like within a week or two, which is pretty good given the cost and the size of all of that. I did have to ask through my provider personally, but generally people can just have somebody who does have access to a computer and who's savvy to the system help them get registered. So that's been pretty big. And I think this is the second year running that they've had that program in place.
Thank you so much for sharing. Go ahead, Torrey.
I was just that thank you so much for sharing. That was really, sounds like an excellent program.
Another interesting comment here in the chat. In Japan, where it's very hot and humid and a significant elder population, every day on TV, the newscasters spoke to viewers on how they should combat the heat, and turning on the air conditioning, drinking water, and that sort of messaging. Persistent messaging is, I'm sure, goes a really long way to addressing, helping with the behavior change and the culture component of it.
Yeah, absolutely. Ellen, I see your hand is up.
So I'm interested in a couple of things. I live in Needham, Mass, where on August 8th, we had a climate catastrophic rain event, so flooding. And as we found out in New England, we're not used to floods like this. And we had 215 approximate homes and businesses flood, and the town pretended almost like it didn't happen. They tried to declare a disaster, but they didn't act like a disaster like Leominster did. You know, Leominster, the mayor was right on it. They called the Red Cross, the Salvation Army, and, you know, probably Army Corps, you know, everybody. And so my question is, how can the medical community, people like you, Caleb, interface with town governments, health departments, town managers, select boards, and make sure that everybody, we actually have DPW people in our town believing that climate change doesn't happen. And so our building inspector, when they're coming to inspect homes that were flooded with 6 feet of water from climate catastrophe, oh, this isn't because of it. So how do you, as a medical healthcare professional and, you know, scientists, how can you guys help to, you know, get town governments, municipal governments on board with understanding all of the ramifications of climate, heat, flooding, you know, tornadoes? I mean, like, Massachusetts is not a place of tornadoes. We had tornadoes this summer. Like,
but it sounds like the question is sort of getting climate resilience into the conversation at a municipal level, which is a great question. I mean,
but also healthcare professionals interacting with that, because look, our town didn't do anything to help us, and I'm dealing with impoverishment in my community. So like to get like a board of health, to get a senior center, to get all of these things, to have a plan in place to help people on the personal health level as well.
That's a great question. I mean, I think there's, again, no silver bullet and a lot of things we can be doing. I think one thing I would highlight is education, which is partly education of public patients and policymakers, but is also education of physicians and education of nurses and education of others in healthcare to understand these issues. Because as you are describing with town government, healthcare is an incredibly diverse field. And there are people like me that are working pretty much full time on climate change related issues. There are other people that are very much not. And so I think, you know, some of the long-term stuff that is going on right now is getting climate change information into the core content that is covered in medical school, for example. And so Harvard Medical School, for the first time this year, is including climate change in its core curriculum because that has been identified by students and faculty as being an issue that will affect doctors and their patients that they need to know about. That's a long game, right? That's getting people trained over the course of their careers. I think there's also a lot that can be done much shorter term, some of which is coming from the health community, but some of which is all of us together as a society stepping up to say these are linked issues, right? Housing is a health issue. Health is related to housing. Like, these are not unlinked things. And so for one example of how that's being done well, I would point you toward the Resilient Mystic Collaborative, which is a organization that is working with, I think it's 14 or 15 towns in Massachusetts from Boston north in the Mystic River watershed, and that has involvement from civil society organizations, academia, and town governments, and has been very effective at helping municipal governments identify climate-related threats to their community, understand why those matter, and then pursue state grant funding to address them, which I would sort of point you to. I'll drop it in the chat, a link to that organization, as a model that has worked well and could be replicated.
Kill that really resonates way you've been speaking of that. I think at Northeastern, what we're really trying to elevate is how interconnected these issues are. Not because we think they are as people working here, but as part of our process of engaging community, hearing how much housing, we're talking about climate change, but we're hearing how much housing is an issue, how much transportation is an issue, how much asthma and pollution, air pollution are an issue, and these all contribute. They combine. So if it's a hot day and you have asthma or are struggling in more polluted areas, it's going to compound that. If you have housing instability and so you can't afford your utilities, that's going to impact how you can keep you and your family cool. So recognizing as we can bring it up as we talk about it, each of these issues, more we can connect them to the impacts and to the other related issues. And the more I think we give value to all of those issues.
Mm-hmm.
So I'd love to hear how others kind of see those connecting as well.
Annie, you have a question as well? Oh, you're muted.
I thought I unmuted. Thanks. It's been very interesting to hear this conversation. I'm glad that there's some forward-looking, people at Northeastern. I guess my question really is, having experienced a 20-degree difference between my area in North Cambridge, which is somewhat leafy, and an area in Mount Auburn Cemetery where dawn redwoods were planted. It was 20 degrees cooler around these redwoods. They're amazing trees. But we, like many, many other communities in the Commonwealth, have seen increasing, not decreasing, cutting of trees, increased heat. In Boston, there was a well-known case of this park that had so many trees cut. They negotiated to bring it down from 55 trees to 29. Lexington Board of Planning has partial control over Cambridge's main water supply, which I think it's something like 5 acres of trees. There are literally thousands of trees that are slated to be, or were slated, I don't know the current status, to be cut. I wonder, can Northeastern, for example, work? In other words, develop working personal relationships with city government, with City Hall, in trying to bring the environmental piece, especially the green. The trees are crucial to cooling urban areas. Can you, for prevention, they are our cooling systems. Can you bring that, those voices, your expertise and your knowledge? Can you even lobby City Hall to have some sort of commission that they form, or whatever mechanism it would be. That's my question. Thank you.
Yeah, thank you, Annie. It's a great one. Trees are really a big, have not the solution, but certainly have a lot of impact on how we all experience the urban environment and how we all experience heat. I went to our director for our landscape and our arboretum is really dedicated to these issues. So Northeastern's Boston campus is an arboretum. We've actually been working with other nonprofits and institutions to try to help them and other city parks become arboretums as well. And we're really focused on how we can advance some of that cooling, not just in our campus, but sort of at the edges. And some of that, sometimes that actually is partnerships with city government. For example, there's a park near the edge of our campus, a long stretch of a street and trees, and those trees are not doing so well. But we are sort of proposing some opportunities for how we can improve, not really improve keeping those trees alive and the health and maintenance of those trees, where we actually, even though it may be city land, we're invested for our community and our neighbors to really do the best to support the healthy growth, because we know that's so important to these areas. So it hasn't been sort of a broad scale lobbying, but a little bit more of a strategic, how can we work together to really build an urban forest that works for everybody.
Yeah. All right, we just have a couple more minutes here. Are there any more questions from the participants? If not, I was going to ask one final question for each of you. Maybe we'll start with you, Caleb. And what is sort of the one takeaway or call to action you would like folks to come away from this discussion with?
I'm going to start basic. Check on your neighbors, check on your friends, check on your family when it's hot, and talk about the fact that it's hot and make sure they're safe. And I think that one step, if we all do it, is going to save a lot of lives.
I love that. Just again, like reinforcing that culture that heat is a threat that we need to be paying attention to. Torrey, over to you.
No, that was great. I would say keep thinking as institutions, as individuals, how you can take a step in this direction, whether it's reaching out to a neighbor that you haven't before, you think might be isolated, or reaching out to your community and asking, what is it you need? What can you do? Seems like the more of us that do that, the further we will get in addressing this issue.
Thank you. Thank you both so much. Unfortunately, looks like Ted was still at the hearing, so unable to join, but it was a great conversation. And Samantha, any closing thoughts or comments from you?
Yes, thank you, Leah. On behalf of Crew, I want to give a huge thank you to our moderator and speakers today, along with all of the wonderful members of Crew and Better Future Project who helped with Climate Prep Week and make this panel happen. And thank you to everyone who joined us today. We are so grateful for your time, and please check out our website to find out if there are any upcoming Climate Prep Week events happening in your area. And with that, I will say farewell. We made great time, and hope to see you all next year at for Climate Prep Week 2024. With that, yeah, I think that's it.
Thank you so much for making this panel happen.
Yeah, thanks everyone. Have a great evening. Bye.